what do you think are the common barriers to efficiency in the criminal justice system, and what have you done to overcome them?
All right, so I'm going to start this time. You know, let me go to the judge's point. I was at an event, and I was speaking to a room full of people, and among them were folks on the Tribune editorial. And I said, I was talking about some of the issues and some of the challenges we have. And I admonished the gentleman from the Tribune that they weren't really covering these issues, that they weren't covering the disproportionate impact of our criminal justice system on black and brown communities. They weren't talking about the inefficiencies in our courtroom. They weren't talking about the rising population in jail as a troublesome issue. And I said, it's because you don't care about the people who are in our jail. Because they're black and brown young men, they're disposable. And he wasn't happy with me. But, you know, I think that's something we have to say in this country, you know. Racism is at the core of a lot of this, you know, and we would not tolerate a criminal justice system that was so ineffective and inefficient if our jails were full of white people. But our jails are full of black and brown people, and we don't care. And that's troubling to me.
I was heartened when the chief talked about some of the things he's doing beyond law enforcement to reduce the crime rate in rural. You're talking about after-school programs, mentoring programs. Those are all incredibly important. I think one of the other barriers to an efficient system is, and I happen to whisper a few words to the judge from Pennsylvania, and they're having the same experience there, and that's when states are in the midst of fiscal challenges, as our state is, that there is a cutback in mental health services. And we have made some inroads in the state, but I think we've given them all back. And I think once again, the county jails may be the biggest provider of mental health services in the state.
They are.
And you want to reduce population by 1,500, probably 15 to 20% of the people in our jails are people with mental health issues. And when the state has closed down the zone centers and closed down mental health treatment centers and has reduced funding to the private sector, the system of human services, that's something I deal with every day. We have organizations that were founded on the principle that they were going to provide mental health services, and the state would reimburse them for their services. And you know the story, it's every day, right? They're not getting paid, or they're getting paid 18 months after delivery of services, they're reducing staff, they're reducing caseloads, and that has as big an impact on county jails and criminal justice systems as anything we're facing.
I think to follow up on what he said, and again, it's not always instructive to try to put the blame elsewhere because there's plenty inside the system, but all along the road in our society, we're heading toward this train wreck of incarcerating our young people. We did a survey last year. We just took a 2-day survey of everybody in our county jail. Because a lot of times when judges give somebody a county sentence, won't parole until he gets his GED. Sounds reasonable, doesn't it? The average reading level was between the 3rd and 4th grade. What the devil is going on in our public school system? The mental health problem is huge. Our statistics put it somewhere between 75 and 80% have serious mental health. Look, why do people take cocaine and alcohol? They're self-medicating. They're not taking it because it tastes good. We're doing the war on drugs rather than a war on the need to medicate oneself. We've got the Veterans Court going because we're happily sending young people off to far corners of the world and bringing them back as mental wrecks and saying thank you for your service and dropping them off the edge of the cliff. So to the extent that we can join in those kind of efforts and the kind of thing that the chief is talking about and steer people out of the system in the first place, people with a place to live and an education sufficient so they can hold down a job are not people who are going out and committing crimes. And that, you know, all of the effort that we could spend, prenatal care, mother-infant care, early childhood education, pour that money in those efforts in up to the 3rd grade, and then maybe we could all think about retirement.
That's the goal. Let me inject just a note of optimism here. I don't want to be Pollyanna, but if we look around the country now, you know, for the first time in, I don't know, 30, 40 years, there's a slight decrease in the rate of incarceration in the United States. That's nothing to get too excited about, but maybe it's the beginning of a trend. If we look at a state like New York, that has sharply decreased its prison population, sending fewer people to prison. You know, it's reduced the draconian Rockefeller drug laws. They're not locking up quite as many people as they used to in the past. We look at our Supreme Court that has recently ruled juvenile life without parole unconstitutional for juveniles, at least in a mandatory sense, and lawyers are going to try to use that decision to try to cut back on the length of sentences that juveniles have been receiving for the last 20 years and expand it hopefully to other areas. As my colleague pointed out, the economic situation that many states are facing are forcing them to look at the money that they're spending on incarceration to the point that they're spending more on that than on higher education, and they're beginning to realize that prevention, intervention, diversion is cheaper and more effective. So there's cause for us to be, if not overly optimistic, at least hopeful that changes in the way that we look at our criminal justice system it's beginning to have some impact in forms like these where we educate each other about what's going on around the country are also a positive example of how we can begin to change the dynamic. We've got to change. We can't continue on the road that we're going. And so I'm hopeful that, we can look forward to some constructive results as we begin to think about these problems in a more thoughtful way.
So lest I be accused of delivering just uniformly grim messages, I want to second what Professor Stone has said. We're at a sort of interesting juncture where the people who, like me, attack the war on drugs as stupid and destructive and casting our substance abuse problems in terms of the criminal justice system rather than as a public health crisis, and people who are critical of the lock 'em up, tough on crime strategies that have been pursued by both Republicans and Democrats over the last 30, 40 years, are meeting the people who say our states are going bankrupt, our counties are in real fiscal trouble. The biggest expense is keeping people in jail. Let's figure out how we can more effectively deal with petty crime than locking people up at the cost in Cook County of $143 a day. So the people who are looking at government in terms of our fiscal challenges and the people who are looking at our criminal justice system in terms of social justice have come together to some extent around this issue. So I think that's encouraging.